Hello, classmates. My name is Latarsha Jones, and for our Thanatochemistry presentation, I have selected postmortem staining as my topic. Postmortem stain is one of the early physical changes that occur after death. This happens when blood circulation stops due to the heart no longer pumping blood. The muscular walls of blood vessel capillary network, particularly the small capillaries, lose their tone and begin to relax. With no active circulation and relaxed vessels, blood begins to pool to the body's lowest center of gravity and most dependent areas. This begins the process of decomposition. Is postmortem staining a physical or chemical change? It's a physical change due to the movement of blood, gravitational settling. The capillaries allowing the blood to flow out and pool is a chemical change. There are several stages that lead to postmortem staining, all consisting of chemical and/or physical changes. The body goes through both physical and chemical changes just prior to, during, and after death. Several stages begin to happen in the body immediately after death that include hypostasis, which is blood pooling, livor mortis, as we said above, gravitas, which is the settling of blood. And let me state here that livor mortis is often confused with postmortem staining. And as we go further into the presentation, I will tell you the steps that the embalmer can take to be able to differentiate between the two. Other factors is the breakdown of tissues, which is hydrolysis, the destruction of red blood cells, which is hemolysis, and postmortem caloricity, which is the accumulation of heme due to the change in body temperature. As the deoxygenated red blood cells accumulate in the dependent areas, we will then see a purplish, reddish purple, or bluish purple discoloration to the overlying skin. The staining of tissues 6 to 8 hours after death progresses as the hemolysis releases the hemoglobin, causing rapid decomposition, and at the same time as other forms of decomposition take place, such as dehydration, color changes, and gas formation in the body tissues. The heme passes through the walls of the pores of the capillaries and moves into tissue space, where it stains the tissues, again a reddish and/or purplish reddish color. Other factors that are associated with postmortem staining consist of postmortem caloricity, again, which is the changing of the body temperature based on environment. This could be either hot or cold, and it's important to note that after a few hours, the body's temperature will become cool to the temperature of its environment. Then we have algor mortis, which is the cooling of blood, and rigor mortis. And this is the stiffening of joints due to the loss of the ATP molecule. Another note worth mentioning here is the use of storing bodies in refrigeration. This process helps to preserve the body's appearance and allows for a longer period of time for the embalmer to prepare the body by slowing down the natural decomposition process. As stated above, there is often confusion in distinguishing between livor mortis and postmortem staining. Livor mortis is extravascular and is able to be treated with embalming. However, postmortem stain is intravascular and is therefore not treatable with arterial injection due to the fact that the stain is outside the vascular system. One method embalmers can use to tell the difference between the two is by performing what is called the digital pressure test. This is done by applying pressure to the area of discoloration, forcing blood into nearby vessels. If the area where pressure is applied turns white, also known as blanching, momentarily, it is livor mortis. The area around the stain that do not move blood and that do not change is considered to be postmortem stain. Now, for the embalmer, this requires more attention and it also determines how we should move forward with embalming the decedent. Hydrolysis will contribute to the breakdown of tissue and the release of bodily fluids, blood, that would then settle and cause the postmortem staining. Remember, staining cannot be removed or treated with arterial injection. So for the embalmer, this requires a higher index of formaldehyde and a higher concentration of preservation chemicals needed in the event of advanced composition. The embalmer should also recognize the fact that both livor mortis and postmortem stain can exist at the same time and location and may not be evident until during or after arterial injection. Lastly, the stained areas may result in the need of careful application of cosmetics to mask the stain, or in certain situations, it may be possible to use certain clothing to cover the stains that may occur as a result of delayed embalming. So let's wrap it up. Postmortem stain is a result of hemolysis, releasing hemoglobin, which decomposes into globin and heme. The heme will then stay in the surrounding tissues, which causes staining. Postmortem staining is extravascular. It cannot be corrected with arterial injection. Embalming can only fix or mask the stained tissues. A higher concentration of preservatives, a higher demand of formaldehyde-based chemicals to prevent further breakdown of tissues. Bleaching agents and careful application of cosmetics can be used to mask the dark stains. Performing the digital pressure test can help determine if it's actually livor mortis or postmortem staining. And last but not least, let's remember that as embalmers, we like it cold. The cold is our friend. It works with us and not against us. Thanks for watching.